Excellent. I see it's recording. Okay, well, let's go ahead and get started. Welcome, everyone. Good morning. Somehow it became September 16th. I'm kind of flabbergasted. Anyway, we're happy to have you all here. And it sounds like there might be a few more people joining us. So we're going to go ahead and talk about the agenda for our meeting this morning. We'll do our usual. At the top of the meeting, we'll do some introductions, and we have some announcements, and then we'll have our brainstorming time where you guys get to share things with one another, ask for some help if you need it, talk about wins, all those kinds of things. We love hearing about updates on cases that you had prior. We love hearing about new resources, anything at all. That's your time. And we're looking forward to having Esperanza Reyes from the Utah Parent Center and Utah Family Voices talk with us this morning about IEPs and 504s. We try and do this kind of a meeting every year, but this one's going to be a little different, and we're hoping that she'll be able to give us some insight into how those things are happening or not happening during COVID, and give us some tips for what we can pass along to families about how to advocate for their children during this very unusual time where some different tactics might be needed. And we'll certainly be talking about that as well to figure out, just amongst ourselves, perhaps in your own experiences, what's going on with the families that you're working with. And then we'll wrap it up and be done at 10. All right, so with that in mind, let's go ahead and do introductions. And we can go ahead and get started with the people who are connecting by computer, because I can see their names, and then we'll do those who are calling in for their audio. So I'm Mindy Tueller, and I manage the Medical Home Portal and this meeting, the Utah Children's Care Coordination Network. Let's see, I'm hearing a little bit of background noise, so perhaps if I could encourage you to mute yourself if you're not talking, that would be super helpful. And then I'm just going to go down the list as I see it. So Chuck, do you want to introduce yourself?
I'm sure. This is Chuck Northern. I'm a general pediatrician at the university and direct the Medical Home Portal.
Great. And Linnea?
I'm Linnea Bauer. I am the Services Support Manager for the Medical Home Portal.
Terrific. And Cassie Crane?
This is Cassie. I am the Medical Home Coordinator at Wasatch Pediatrics South Point.
Terrific. Welcome. Okay, and Erin?
Hi. Can you see? There we go. Hi, I'm Erin. I'm the Administrative Assistant for the Medical Home Portal.
Terrific. Tiffany? Let's see, Tiffany, you're muted. Don't know, maybe Tiffany's having some trouble with unmuting. I know Tiffany is with Utah Valley Peds. And Evelyn Hernandez?
Hi, my name is Evelyn. I am also from Utah Valley Pediatrics. I'm the care coordinator in the Cherry Tree office.
Wonderful, welcome. Sherilyn Hess.
I'm the care manager at Intermountain Pediatrics in American Fork.
Excellent, welcome. Natalie Allen. Natalie, you are muted. Okay, Natalie may not be able to unmute either. Gosh, I'm not sure what's going on, but I know Natalie is with the Integrated Services Program. The next person I see on the list is just some initials and numbers, so I'm not sure if you'll recognize this, but DRP 13.
That's me. I don't know how to have my name show up. This is Heather with Wasatch Pediatrics and Draper. I'm the Med Home Coordinator.
Great, welcome. No problem.
Thanks.
Next I see Katie. Katie Vogt. Katie is also muted. That might be giving her some problems. So I know Kate. Yep.
Sorry. It's Katie, and I'm the care coordinator at the University Pediatric Clinic.
Terrific. All right, and Gina, Money.
Hi. Sorry, I can't get the video working either, so I'm glad I have at least the audio. I'm Gina Money, and I'm family advocate with UCCCN and Medical Home Portal.
Great. Sorry about the technical difficulties. I think that's just par for the course these days, right? All right, Dora with Shriners.
Hi everyone, my name is Dora. I am the Professional Relations Coordinator at Shriners Hospital for Children in Salt Lake City.
Welcome, terrific. Glad you're here. All right, Heidi.
Hi, I'm Heidi Bates. I am with UPIC. I'm one of their QI coaches, and I can't get my camera to work either, so I'm sorry, but hello.
That's okay. Glad you're here. Walt.
Yes, good morning. This is Walt Torres, Care Coordinator with Integrated Services Program through the State Health Department, and I'm part of Eric Christensen's group.
Great. Welcome, Walt. Angie Richens.
Hi, I'm Angie Richens. I am the Director of Behavioral Health and Case Management for the Alpine Pediatrics Group.
Glad you're here. Okay, and Heather, not sure if this is the same or a different Heather.
It's the same. I edited
Okay.
the name.
Gotcha. Okay, very good. And
Thank
next
you.
is Brooke Bastar.
Hi, I'm Brooke. I'm a care manager at the University of Utah Sugar House Health Center.
Welcome. And Eric Christensen.
Good morning, Eric Christensen. I'm a program manager with Utah Department of Health Integrated Services Program.
Good morning. Esperanza.
Good morning, everyone. This is Esperanza Reyes with the Utah Parent Center. I'm excited to be joining the meeting today and look forward to the presentation.
Wonderful. We do too. Thanks. All right, Tony.
Good morning, everyone. My name is Tony Estrada, and I'm with the Integrated Services Program. I'm a care coordinator in the Ogden area.
Welcome. Mindy Butters.
Good morning, this is Mindy Butters. I'm the care coordinator at Utah Valley Pediatrics in Provo.
Great, glad you're here. And Athena.
Hi, Athena Parker, and I'm with the Medical Home Portal and update the service directory for Utah.
Wonderful, glad you're here. And Brooke Christensen.
Hi, this is Brooke Christensen. I am a care coordinator with Utah Valley Pediatrics in Saratoga Springs.
Great. All right, Gabby, I hope you're hearing us.
Yes, finally, I had to shut down my whole computer to be able to hear you guys. So yeah, I am Gabby Baragoshi. I'm one of the QI specialists at UPIC working with Heidi. And I'm just happy to be here today, I guess.
We're happy you're here with us too.
Thank you.
Great, and Cynthia.
Hi, I'm Cynthia Palacios Gutierrez, and I'm a clinical psychologist for the Integrated Services team here at the Utah Department of Health.
Since you may not see the number associated with your call-in. So if anyone's just attending by phone if you'd like to go ahead and say your name now, that would be great.
Good morning, this is Katrina Jensen, Intermountain Healthcare Pediatrics Community-Based Care. Thank you.
Great. Caller 9. Wonderful. Thanks, Katrina.
This is Corrine Romero with the Connector Service at Primary Children's.
Terrific. Caller 6. Okay. Glad to have you, Corrine.
Thanks.
Anyone else who is just on the phone?
Can you hear me?
Yes.
This is Nikki. I am a registered nurse care coordinator with Busy Bee Pediatrics in Bountiful.
Hi, Nikki. It's great to have you. Caller 1. Terrific. Anyone else who's coming in by phone?
Andy, this is Katrina. Were you able to hear me?
Yes, we've got you, Katrina.
Okay, perfect. Sorry, because then it cut out, so I apologize. Thanks.
No worries. All right, very good. Well, I think we'll go ahead and...
Hey, Mindy, we have Natalie Allen attending. She's writing, I'm attending by computer, but stepped away for a second. This is Natalie Allen. I'm the nurse practitioner of Integrated Service Program.
Great. Welcome, Natalie. Glad you're here. Okay, very good. I think we'll go ahead and move to our announcements. Just wanted to remind you that if you have the opportunity to attend our meetings via a computer or perhaps a smartphone, your experience is probably a little bit better, and then we know who you are as well. But we're just glad you're here in any way that you can. So Eric Christensen forwarded me a rather more formal announcement about the University of Utah's call-up program. We talked about this, I think, back in January. So that may have been a soft rollout at that point, but they are doing a bigger marketing effort right now to let you know about this new psychiatric consultation service. So we have this in the Medical Home Portal's service directory, and just wanted to remind you that this is available. And I don't know, Eric, if you'd like to say anything about it, you certainly don't have to, but Eric forwarded me what they've been sending out, and I'll make sure that we have some information that goes out with the resources of the month to help give you a little bit more of an understanding of what this service is. But it is for patients 24 years and younger. There's no cost, and the hours are Monday through Friday, excluding holidays, in the afternoons, 12 to 4:30 p.m. I'll just show you some of the stuff they sent.
And Mindy, I'm sad to say, other than what they sent to me, I don't have a lot of other information, although I did have to send this to my sister who has a tween who's having some issues so that she could try to call these folks. And I don't know if she has, but the timing of this coming through was really good for our family. So anyway.
Okay.
So
Yes,
what I know about its service is that providers and other people can call up. You can either do it by clicking on the link and do it via, email, or you can call them up and then request that they call you back, or you can arrange a time and you can talk to them. So that's pretty much all I know about that.
Okay. Thanks, Gabby. Great. Well, yeah, if I understand correctly, just from the email that got forwarded, this is a legislatively funded program. So I remember hearing something, gosh, maybe it was last fall, that was talking about, some funding that was going to be put towards some kind of program, and this is clearly what that is. So hopefully it provides a more, direct way of getting in touch with a psychiatrist for primary care providers and also patients. So if you have an opportunity to use it, let us know how it goes. And more information will be in the resources of the month. Okay, and just a reminder, hopefully you all have been seeing some emails come through about our, or the second annual adult and Young Adult and Adolescent Transition Summit that's happening again this year, October 8th. This time it's virtual. Last time it was held up at the Eccles Outpatient Building. Last time it was a little bit longer. This time it just goes from 7:30 till I think 12:30. And there's no cost, but you do need to register. And again, an email should have gotten to your inbox by now from Stephanie Sund, who spoke with us briefly about this last month. There's also a transition survey. And again, this is following on the one that was done last year. So it's really helping to understand what practices and organizations are doing and looking at progress or change over time. So we hope that you'll complete that as well. I will make sure and send those links out. I'll probably do it right after this meeting so that they'll come 2 times, both separately and then also in the resources of the month. But it would be very helpful if you'd be able to complete the survey. And also, we really encourage you to attend the summit if you possibly can. Right.
Cindy, this is Katrina. I have just a couple things I could add. I appreciate you sharing that again with the team. Yeah, I'm working on this summit, and the survey will close soon. So if you have priority, get the survey done sooner because we need to calculate the data and get that ready to present at the summit. So that would be really helpful if you could do that soon. Registration, if you haven't established an account with Intermountain CME, that is one step that takes a little bit longer in the registration process, and don't be deterred by it. Some people got hung up on the code because it is free, so you just can bypass that. That's like one of the earlier pages. And then after that it goes pretty quickly. So I was one of those people that had never registered or logged in for an account, so I was like, wow, this is a little bit longer than normal, but then I understood what the process was. So does anyone have any questions about the summit or either of those things I just discussed?
I know that I tried to register the other day and it kind of felt like a circular argument. I kept coming back around to this registration. I'm pretty sure at some point I may have had an account because I registered for the summit last year, but it kind of never got me.
They have a new system, Eric. So
okay, should I try again then?
You know what? Either try again or reach out to Stephanie. She was unable to attend this morning. She's having power issues at her house still, electrical stuff. So yeah, because admittedly, it's just sometimes things don't work, unfortunately.
I'll try.
Continuing to be patient with that. Yeah, perfect.
Okay, and Katrina, do you know when the survey will close?
That's a good question. I would just encourage people to get it done like maybe by the end of the week. Would that be, I think or next week probably. Maybe next week is probably, but yeah, sooner than later.
Okay.
Because that all takes time, as you know, to calculate and tabulate and.
I do. Great. Okay, I'll encourage folks to act on the survey first, and then to not be deterred by me in getting registered, they can.
Yeah, anyone has any issues, they can reach out to Stephanie Sund on the registration piece. Surveys, I think, pretty straightforward. Red cap.
Yeah. Good stuff. Okay, terrific. Thank you. All right, we just wanted to let you know that we've got some updates to the Medical Home Portal's content. We actually have a brand new page on mental health screening for children and teens. So we'll encourage you to check that out. We've done some updates on our intellectual disability and global developmental delay module, as well as our ADHD module. We also have some updated content in our For Families section, including additional early services, information, transportation options for young adults. That used to be called Transportation Where's My Ride? We've changed the name of that and updated that information, and a corresponding page on transportation and travel for people with disabilities. And we just want to remind you that we have a COVID page that continues to get updated regularly with information that could be helpful for you. So please go ahead and check that out. It's in the big banner across the top of the medical home portal, and there's information specific to Utah there as well. All right, so this is your time. If there's anyone who has anything they'd like to share or ask for help with, this is your opportunity to connect with the group kind of in real time. I'll just remind you that if you don't necessarily have a difficult case, you can also let us know if there's any quality improvement efforts that you're doing. If you've been able to utilize the motivational interviewing techniques that we got in July, those kinds of things are great to talk about during this time as well. I'll also just throw out the question, how are people doing, currently with COVID? We've got potentially the flu season ramping up, and just curious to know if anybody, if your organization has been pivoting even more in anticipation of fall. What's been happening?
Mindy, this is Katrina Jensen from Intermountain Healthcare. I had the opportunity, I do a Channel 2 Baby or Baby spot once a month, and yes, we did do the flu, reminded people how important it is, how easy it is, that the flu mist is safe for kids 2 to 49, that it's been approved, it's been around, just because there's so much talk about the other vaccine coming and how will it be safe, et cetera. So yeah, to really encourage, and the other thing I really tried to encourage was, please don't go to school, don't send your child to school, or don't go to work if you're sick, because that just continues to be a problem. But I also, paired with all the good things we're doing with hand hygiene and masks and how helpful that will be also during flu season, and to continue those practices. So
great. And Katrina, when was that spot?
I can send you the link. It's on the live news on the third Friday of the month, or second Friday of the month. Yeah, I'll send you the link.
Excellent.
I've been doing it for years, and just different topics every month.
Great. We'll look forward to that. Thank you. That's important, really good stuff. All right, anybody else?
Mindy, this is Tony with Integrated Services. And I just wanted to tell about my case, positive thing that happened. Recently, I finally got this family Medicaid for her disabled son, who hasn't had Medicaid for probably 3 to 4 years. And so she hasn't taken him to the doctor, and he has a G-tube and autism. He's nonverbal. He sees an orthopedist, and has just a ton of issues, but she's Spanish speaking and was having a lot of trouble getting Medicaid, and would just give up and things like that, because they just would keep asking for more and more documents. But we were able to finally get him Medicaid, so she's going to take him to the doctor, and he's finally going to get his medication and his supplies and everything that he needs. So I just wanted to share that.
Tony, this is an update to something you brought up a couple months ago, isn't it?
Yeah, I think I did bring it up, and I was asking for, I was really frustrated with the Medicaid process and everything, but we finally got it.
That is such great news. This is Katrina. What did you find, or what barriers did you have to overcome? There were so many barriers, as I recall.
Yes, that she was Spanish speaking. She didn't really understand a lot of the forms that were being sent to her, a lot of documents that were being asked of her. And she would just get really frustrated and just kind of give up. So this was something that was going on for a few years. And then finally, I just, I just had to keep telling her that it's, that's just the way things are, and just kind of encouraging her, and just telling her to be patient, and just positive things like that, and it finally paid off.
Well, we're all really, really pleased to hear that. It's so nice to get some good news.
Yes, I'm so excited for her and for him that he'll be able to see a doctor finally.
That's great. Well, we'd love to hear about the continued, updates.
Thank you.
Oops. Okay. Great. All right. Well, let's go ahead and move to our main part of our meeting. And again, I'm really excited that we have Esperanza Reyes with us. So I think some of you know that Gina Polomoni has stepped down from her position at Utah Family Voices and Utah Parent Center, a much deserved retirement. And Esperanza is her replacement. And Esperanza, if you'll go ahead and introduce yourself and tell a little bit about yourself. She's got wonderful credentials, and we're really pleased that she was able to share some of her time today. And Esperanza, if you just want to let me know if I should give you the presenter controls or how you'd like to do it.
Yes, thank you, Mindy. Thank you for that great introduction. As Mindy shared, I'm the current Associate Director at the Utah Parent Center, Gina's successor. Of course, Gina's always missed extremely, and she, throughout the years, was a wonderful mentor for me within the Utah Parent Center, so I'm glad she's in this meeting with us today. In the Utah Parent Center, or within it, I should say, I have played different roles. I've been in the role of parent consultant, project coordinator, and associate director at different points in time. I've been with the center since 2013 and have just enjoyed the journey. I'm a parent myself of a 12-year-old with an autism spectrum disorder as well as mental health needs. And I do have an almost 2-year-old with some special healthcare needs of his own. Currently, he has trigonocephaly, craniosynostosis, so his suture fused earlier than it should, and so we have frequent appointments that we attend on his behalf, and that has given me another window into what families experience, being one myself. With the Utah Parent Center, we are all parents of individuals with disabilities, everyone that provides consultations and services to families. And our staff is quite incredible. We have a variety of projects, one of which is Utah Family Voices, which many of you, I'm sure, are very familiar with. And just the service that the center provides is so inspiring to me. And the staff is just, like I said, more than incredible. So it's always been fulfilling work on my end. So that is me at the Utah Parent Center. Mindy, in terms of sharing, we can attempt to have me share my screen. I did email you a PDF of the presentation if that's easier for you. So whichever route we want to explore is fine.
Okay, I think it'll be a little faster if we give you the presentation abilities. Let's give that a try. Okay, in theory.
Oh yes, it did come up.
Okay.
Let me see. But the PowerPoint is not coming up. Let's see. Oh, there it is. Share. Let me see if it's showing up.
It is.
Excellent. And then We'll go from the beginning. Oh, good. I can see how it looks on your end, I think. So, okay. Well, these are different times. I think we all know that, and we're all experiencing that. So we're going to have a conversation about IEPs, IDEA being the Individuals with Disabilities Education Act, as well as Section 504 of the Rehabilitation Act of 1973. We're going to do a brief overview of what those are, how they generally operate within the school setting, and then we'll delve into the difficulties, issues, needs, and out-of-the-box ideas for what's happening with our families and our kids with special needs within the schools under COVID. This is my information at the Utah Parent Center, should any of you wish to make contact. So again, as I just shared, we're going to do a brief overview of IDEA and Section 504. Then we'll discuss the choices in education that families have. And right now, those are many. But there are implications depending on which choice a family chooses. So we'll briefly touch upon those. Another major area of concern for families has been the requirement to wear masks. So we'll briefly touch upon that and how that's playing out in the school setting. And then we'll go over general recommendations for families, as well as general expectations for schools and the school system for our students under this COVID time. The first thing I want to bring to everyone's attention is that both of these support systems within the school setting are really built on the idea that parents are partners in the education of their children, that they do have a lot of information and expertise to give, and indeed that they might be the ultimate expert on their child. And so whatever is happening in the school setting should be something that parents are intimately involved with, intimately informed about, and also feel empowered to make choices on behalf of their children. Okay, first let's talk about IDEA, the Individuals with Disabilities Education Act. This is a federal education law for a child with disabilities that provides for what we call an IEP, an Individualized Education Program. This document is a legally binding document that is also quite flexible in that families and schools are able to make changes and adjustments based on what the student is needing in that school setting. It does pretty much outline the educational experience the student is going to be having within a school or a local education agency, or LEA as we call it, which is a school district or a charter school. Now, special education in and of itself is specially designed instruction. And this is important because ultimately what is going to differentiate it from a Section 504 plan. And we'll delve into 504 after we're done with IDEA. But let me highlight that specially designed instruction really is that key component within an IEP. Now, that might be specially designed instruction, and that generally means altering the methodology, the delivery for the student of that instruction, because they're not able to benefit and make progress and grow from the general instructional methods that are taught in the school setting. So because they need those adjustments, they are said to require special education, and that special education can be delivered in a variety of settings. It could be instruction in the classroom, at home, in a hospital setting, or even in an institution. And it is also said to include special instruction, specially designed instruction in physical education. So adaptive PE is included within special ed. Now, a key tenet of IDEA is the notion of what we call FAPE, or a free, appropriate public education. Now, this is provided at no cost to families, so it shouldn't cost them anything out of pocket to access the variety of services and supports that a student with disabilities may need. It is provided as directed by the IEP, and that might seem a little redundant, but that kind of redundancy was built in on purpose to say, whatever the child needs goes on the IEP, and if it's on the IEP, it should be provided. And because it's on the IEP, because the student needs it, therefore that creates that particular student's free and appropriate public education. So as you can see, the definition of a free, appropriate public education is not one thing. but it is whatever enables the student to make progress at school in the educational setting in light of their impairments. And it is there for them to make meaningful, appropriate growth. Not an easy concept to grasp and certainly not easy to pinpoint, but it is something that is born from the process of having conversations and doing evaluations. But we're going to look at the process more closely in a second. Now, something called the procedural safeguards are the parents' and the students' rights within IDEA for special education. Procedural safeguards are there in place to make sure that the students and the families are being protected in terms of how the process develops for them. It gives them rights to access their own records. It talks about confidentiality for those records and that information. It talks about consent and how important it is for families to provide that consent from the very beginning. Special education is not something that is necessarily forced on anyone. It is something that families choose to access and should provide consent for. There are disciplinary procedures. So if somebody were to have a lot of behavioral needs or run into behavioral difficulties at school, and perhaps there's suspension on the table or expulsion on the table, what sort of steps are required when a student has an IEP. And it talks about how those are dealt with in the school setting. It may talk about how many days they could be out of school, for example, without any issues, or what happens if they're out of school for more than 10 days. And even talks about things like manifestation determination hearings, which are a process just under special education to determine whether something in the student's behavior and the actions they took was actually directly related to the disability, in which case no consequences should be applied, but more supports and services should be delivered and provided. One other piece within the procedural safeguards are the dispute resolution options under IDEA. IDEA provides for a variety of options to problem solve. And we at the Utah Parent Center do believe in the importance of the relationship with the family and the school, because typically it tends to be long-term. If a student has special needs, we know they're going to need supports for a variety of years, perhaps in the school setting, maybe not always so. It's not, of course, clear-cut for every student, but it is important for that relationship to be as healthy as possible. And within dispute resolution, there are ways to escalate how an issue gets resolved. And there are options such as mediation that is provided for under IDEA. There are options such as state complaints that could be filed by families at no cost to them, and an investigation would take place. There's even due process within special education that is quite similar to what we think of as a trial, where there's a hearing officer that ultimately is like a judge, and there's evidence that could be presented on behalf of the family and the student, or on behalf of the school district. So there are a lot of ways to ensure that the rights of the student and the parent are followed, and ultimately that the student does benefit from his or her education, but the onus is placed on the family to actually request these processes and go forth with them. So this is a vast, complex area, as you can imagine, as you hear me talk about it, but it is there to support families. Now, an IEP is your child's written individualized education program that is developed, reviewed, and revised in a team meeting. Again, a team, a partnership. There's a variety of professionals that are involved and required in IEP team meetings. Some of the required members include a special education teacher, the parent is a required member, somebody representing the local education agency, tends to typically be a principal, or perhaps a related service provider. And those related services could be peripheral to support special education, and we think of them as individuals that provide therapies. So for example, a speech language therapist, an occupational therapist, a physical therapist, those are possible related service providers. And if a child is receiving speech services, for example, it would be required to have a speech language therapist or pathologist be part of those IEP meetings, because that person is seen as necessary to help make choices on what goes on the IEP for the student. Now, if a student has an IEP, they generally don't need a Section 504 plan. And that is because the Section 504 plan really focuses on modifications and accommodations, not modifications to the curriculum, but modifications in the environment, for example, that are seen as accommodations. So typically a student, if they have an IEP, any support they might need is written into that plan. That plan is more comprehensive, and it is a law that is education specific. So all of the nuances of what goes on in a school setting are included in an IEP. As we will hear soon, a 504 is not school specific. Therefore, the way it was written does not really explore every single area of what happens in a school, but it is thought that best practice is that it mimics the process of an IEP, and we'll go into that in a second. But if a student has an IEP, that is comprehensive enough to not necessarily require a Section 504 plan separately. The education process, this is a wonderful graphic that explains it. A student is referred into special education, typically by a family member or by a professional in the school. They are then evaluated depending on the needs that are expressed. So the evaluation looks different for every student, but it should focus on all of the areas of need. Again, if that is speech, and a speech evaluation, if there are behavioral components, perhaps a behavioral observation, or some sort of assessment or inventory is taken for the student. So it depends very much on the needs, but they are evaluated. There is then a meeting held with the members that are required, typically what would be required of an IEP team, the members that I shared before. And it's discussed whether the student is eligible for special education. And the questions they ask are, is there a disability under IDEA that is applicable here? And if the answer is yes, the next question is there a negative impact educationally for the student because of the disability? And if the answer is yes, the next question that's asked is, well, does the student require specially designed instruction? And there's that phrase again, specially designed instruction, which means do we need to alter the methodology, the delivery of the curriculum and the information for the student? And if the answer is yes, then we've got a student that's eligible for an IEP, and the IEP plan is developed within 30 days of having been found eligible at the latest. Placement is then decided. Now, placement is not location. The word itself is more the educational setting where the student would benefit from the services, plus the bundle of services that they would receive. So it's not necessarily the place, it is more everything that they would need in terms of the level of intensity of supports and where those could best be met for the student. And this is reviewed every year, this IEP. And if we find that at the end of the review, we have to do additional things, we can go through this again and say, okay, we need another evaluation to understand these other needs that now we know the student has that maybe they didn't have before. Then let's talk about, are there other services or other accommodations that they would require? The IEP is adjusted, and it is quite a flexible process, all driven by the student's need, ideally and in theory. Now, during IEP development, the team has to consider the child's strengths, not just the needs, the concerns of the parents for the child's education, not just the professionals' concerns for the student's education. And of course, they have to look at the evaluations and the results. And lastly, it is not just about academics. It is about developmental milestones and where the student is if there are gaps. It's about the functional needs of the student and how they are able to meet their environment within the school setting, and what other things we have to consider for the student in terms of adding services and supports goals onto an IEP. Now, the IEP meetings happen at least once a year by requirement. However, a student might change, as we all know. Their needs might change from moment to moment, from month to month. It could have been 2 months since the last IEP meeting, and the student maybe has had a crisis already where the team needs to meet again to discuss what has happened and how they can adjust. So this is as needed. That is truly the best way to describe IEP meetings. There are certain requirements that must be met in terms of timelines. at least once a year, but as often as they're needed, to make sure that that IEP document is actually helpful to the student as they are navigating school. There is another incredible tenet under IDEA, and that is the least restrictive environment. This really is that to the maximum extent appropriate. That means, you know, as much as we can. Children with disabilities are educated with children who are not disabled. This doesn't necessarily mean that they are never educated with children who are only disabled or have IEPs. We all know that there are special education classrooms and special education schools, but the needs of the student must require that or must dictate that need. It is possible that a student's disability is so intense, if we take behavioral needs, for example, so intense that they require constant intervention and constant support, which is okay, it can be done, but perhaps the general education classroom is not the best place to do it, in that it might be constantly disruptive to the teacher, for example, and they're not able to proceed with the lesson, or there's something in that environment that acts as a trigger for the student. So there's just many variables that could prevent a student from being educated in a general education classroom, but that really is sort of the gold standard, that if we can, we will. And it should not just be based on curriculum adjustments, for example. So if a student has a lot of learning needs, a lot of modifications that they need to happen to the curriculum, that's the general education environment is still something to consider, but it's not a guarantee. And that is something that IDEA does make clear. Okay, I'm sure that was a lot to absorb, but let's go on to Section 504. Within Section 504, as I said, that is under the Rehabilitation Act of 1973, and it is a civil rights law. It is not an education law. It is broader. It prohibits discrimination in programs that receive federal funding. And as you can imagine, it's beyond schools. For schools, though, it does provide a plan on how the child will access learning at school. And this is about access. Equal access and opportunity. That is the focus of a Section 504 plan. How is this achieved? It's usually achieved through accommodations, and we'll talk about them in a second. But Section 504, just like IEPs and IDEA, do have the requirement of a FAPE, a free appropriate public education. And there is a question of placement. Where do they receive their education? Typically, when a student has a 504 plan, they are pretty much always in a general education classroom receiving accommodations there, and those would be appropriate supports, again, at no cost to the family. They are receiving the same instruction as the general education student that doesn't have those needs, and they are able to make progress with appropriate supports in place, not necessarily by receiving specially designed instruction, but the same instruction that everybody else is receiving. And again, that is truly the key distinction between special education and 504. Special education provides appropriate supports as well, in addition to specially designed instruction. Section 504 does not provide for specially designed instruction. They do provide appropriate supports. Now, Section 504, definition of a disability. That is an individual with a physical or mental impairment that substantially limits one or more life activities. And what are those, you might ask? We do have a list of what they could be. These are not exhaustive. This is a general list. It could be that the student has difficulty seeing or hearing or eating or sleeping. Everything here you see before you, reading perhaps, processing and thinking, communicating. All of these are needs that may require accommodations. And once those accommodations are in place, may not necessarily require additional modifications to the curriculum or the instruction delivered to the student. So at school, they will ask, is there a physical or mental disability? If so, does it limit a major life activity? Again, the ones listed here, and then some, but these are the most often commonly found. What major life activity does it impact? And here's the question, not just having an impact on a major life activity, but it's got to be related to activities at school, something happening in that school setting, whether it's the assignments, whether it's the way the student is experiencing the disability with communication, for example, perhaps assistive technology is all that's needed. It just depends on how the student is able or not able to go through the school day, go through the educational day. So once these questions are asked, and the answers are yes to all of them, a 504 plan is then written. Now, there's no standard 504 plan because it's not an education law, and this is very much education specific. The plan should be written, but again, that is best practice. It's not an absolute requirement. It could be just an understanding between the family and the school as to what supports are going to be provided. But by far, school districts and charter schools are writing their plans. So typically there's a written plan in the student's record, and the plan includes the specific accommodations, the specific supports, and perhaps any services that might be happening for the child. Now, if there are services happening, and it could happen with counseling, for example, the names of who are providing those services and the person responsible for ensuring the plan is implemented. Every single LEA or local education agency does have a Section 504 coordinator within their schools. And so that person is primarily responsible to make sure that these plans are up to date and they're communicating with the family and that they're being followed overall. Now, an accommodation is a tool or a procedure that provides equal access to instruction and assessment for students with disabilities. Again, it's those supports that could be taking place. An example might be sitting close to the teacher, for example. It might be using a device to take notes because perhaps the student can type, but they're not able to write fast enough for taking notes, or it could be recording the lessons, just a variety of ways to access the information and be able to participate in the day-to-day activities that take place in the school setting. Accommodations must be individualized. Again, not a single plan is indicative of what should be done for another student, even if they share the same diagnosis or disability. It just depends on how that particular student is navigating the school system. Now, the accommodations are meant to place a student with a disability at an equal starting level with a student that doesn't need them. And they are not, again, done to modify the curriculum or change the learning expectations that we have of a student in the classroom. If the student on a 504 plan only should be able to make progress in their education with just the accommodations in place and perhaps some services if needed. That is truly what this plan is meant for and where it really excels. It is an option for students that are able to function and receive that instruction and be able to make that progress. Now, it is possible that a Section 504 plan might need to be tweaked. It is possible that a plan might need to be tweaked to find the right balance, and that's okay. Again, the whole idea is to be flexible enough to have communication with families and to hear from students if they're able to share their preferences and share what's working for them and what isn't, and incorporate that into these plans. So Section 504 would allow students to have some services, but again, it depends on what those services are. They would not be, for example, additional instructional services in the area of reading, for example, or in the area of math, because it is assumed that the student is able to benefit from the instruction that the teacher is providing to all students. Now, schools must provide related services to students who are eligible for services under Section 504 if they need them. And that caveat should be explicitly said about any services that a school provides under any plan. It's if they need them. And how do we know they need them? It would be based on parental input. So the parents would say about the struggles that they are experiencing, or the educators have done some evaluation where this information is coming from and clearly shows that those are needed, or the student is providing that input. So as long as there's information backing up the need, then we can look at services. It is about leveling the playing field. The second image shows additional accommodations to this child here that needs it to see, whereas here it has been removed, and that speaks about environmental changes that would allow, I think that would be beneficial to all. So for example, some of our standardized assessments have changed so that computers are able to read instructions to any student taking the test, and that's okay. It's just embedded in there. That would be an example of an accommodation that would help students that perhaps really had that need before and others didn't, but they can all benefit from using it. So this is a wonderful visual of what accommodations are like and what they're meant to do. Okay, let's shift the conversation to the IEP and Section 504 plans under COVID. Now that you know all about IEPs and Section 504, let's talk about the choices and the worries that parents have had. After soft school closures, parents were really feeling demoralized in thinking, oh my goodness, the year has pretty much ended for us. Maybe there wasn't any communication. Maybe the experience of doing remote learning just felt like my child couldn't learn, and unless somebody was there right beside them, guiding them the whole way, that just wasn't feasible. Families may have sometimes just given up, and truly that experience varied from school district to school district, from teacher to teacher in the supports that they would provide to students and families, and also from family to family, how those played out. Families, of course, are worried about the risks involved. What if their child has higher risks if they were to contract COVID? Of course, they're weighing those options, and were at the beginning of the school year. What if my child doesn't have the ability to wear a mask or social distance, or either or? What am I going to do if those are the expectations at school? And of course, what if this other school district is doing something that what my school district is doing? Is this even feasible for my family? How is it going to vary from place to place? This was all happening, and everybody was learning and figuring it out at the same time, which is a lot to ask of individuals. So patience is something that both sides had to be and have a lot of with each other. We conducted a survey with other partners, and some of the things we learned, for example, these were results that came out in August out of a 933 participant survey that went out to families whose children were on a plan for school. Did they believe that their child received appropriate services when their school transitioned from in-person to online learning? And after reading the comments and adjusting where they truly went with a yes or a no, you can see that the majority felt that no, they were not able to be successful with that. So going into the new school year, that is something they were thinking of. Did they feel that their child could wear a mask or socially distance or use hand sanitizer? And you can see those percentages there, that many of them were very concerned, and still are, by the way. We do get calls about this pretty much on a daily basis, about the difficulties with the masks, about the social distancing, and what ideas do we have for families. We talked about what are they comfortable with in terms of getting services or the delivery of services. And families were saying, on a 1 to 5 Likert scale here, that many of them kind of feel comfortable. These two, they feel very comfortable. I would say, maybe not very, they feel comfortable having their child in a school professional one-on-one in person at the school, having their child in a small group of students in person, as long as it was less than 10. They were least comfortable with more than 10. And as we know, a lot of families decided that their children would go back. So these numbers are going to impact very much what families decide in terms of whether they send or don't send their children into a school setting, depending on whether or not they believe they're going to be kept safe. This is a graphic that was put out by the State Board of Education that talks about the different options when it came to students. And this is important, and I bring it to your attention because it does matter when it comes to IDEA, what somebody chooses. If somebody is doing dual enrollment, for example, students can be enrolled in 2 different settings, whether homeschool or a public setting, whether it's a charter school or a local school district, and they can receive and are entitled to IDEA and everything it provides. Home instruction, that is a choice for a placement. Remember, we talked about there's a variety of placements. This is a placement based on the student's needs. The student would then be entitled to anything under IDEA that they would otherwise receive, but it is an IEP team decision. Homeschooling is not an IEP team decision, and it's a choice that a parent makes if they decide to keep their child at home, but that is not the same as remote learning. So you can start to see all of the different options that parents had to weigh and how it might impact their child with special needs. Remote learning, that is a choice that was given to all families, regardless of whether or not they had a disability. Homeschooling was a parental choice. And then, of course, we muddy the waters a little bit more by saying, oh, by the way, there's also this other online option that allows you to get credits that everybody is able to benefit from as well. And the student is entitled to all provisions under IDEA under this as well. And the language and the vocabulary being used in schools was important in terms of the implications for their child. Sometimes remote learning was being referred to as homeschooling at school, and so parents were confused. What do you mean homeschooling? And we were confused too in terms of, what do you mean homeschooling? Is that still attached to the LEA, or is that you signing an affidavit saying you're homeschooling your child, as it typically is done? And so parents just were swimming in information, and at this point they're still trying to navigate all of this and what is best for their student. Masks, they became a requirement. There were notable exemptions, of course, medical conditions, mental health and disability being notable here for our discussion. So individuals, for example, that had an IEP, or individuals that had a Section 504 plan that would that we already knew their disability would make it difficult to wear a mask or to social distance, IEP teams could make the choice to write into their plans that those were exempt. It was possible that a student might have an additional need, and those plans were meant to be updated. We will talk about general expectations, but I will give you the punchline. Overall, the Department of Education does expect that our students are going to receive a free and appropriate education still, free and appropriate public education still. But we do know in reality that may not always be possible. So it's not something that is going to be done no matter what. Sometimes the risks are too high, the choices that are taken are different, and that education is not going to look so wonderful for the student right now, but there have been, there's a process in place that would allow for a student to recover supports if they were to be in that situation. Nevertheless, we don't go to that option automatically. We have to have discussions with our teams about how to best support the student. Okay. Is it legal to require a medical directive verifying a need for an exemption, or does doing so violate IDEA or 504? The answer to this is that neither federal IDEA or Section 504 really talk about temporary emergency health provisions. Therefore, they're going by their best guess that yes, they can require medical directives of students, just as they do, for example, have requirements in place for mandatory vaccination, even though those have exceptions as well. So at this point, a lot of this is it's not set in stone. It's kind of a process evolving as more questions are being asked, as more cases and situations are being reviewed. But overall, yes, they can ask for them. What if a student already has an IEP or 504 plan and the medical exemption relates to the disability identified in the existing plan? Does the student still need a medical directive? And the answer to that is no. If you already know that the disability does impact the directive, then IEP teams are free to make those choices and those accommodations for students. When a student, by his own choice, or at the direction of a parent refuses to comply with the mask requirement, the school is legally able to exclude the student from school. And that is a hard thing to hear, but it is the guidance that the State Board of Education has given to their LEAs based on their own analysis and, excuse me, their own experience. What if the student who is excluded for not wearing a mask, and this is, by the way, they're choosing not to, they're able to, but they're choosing not to, but what if they are still eligible for an IEP or a FAPE under Section 504? And the guidance is that the LEAs still have to take steps to ensure that they're providing supports and information and curriculum some other way, but they don't necessarily have to be allowed in the school setting. Now, what are some general recommendations? Review the current plans that are in place. Chances are the plans that we're coming into the new school year with, if they were not adapted based on the soft school closures and doing plans remotely, or maybe the student was doing, of course, remote learning and now they're going back to school, those plans have to be reviewed. So families should be having conversations with their teams. Hey, you know, these are some concerns I have. These are some concerns that are emerging. What are we going to do about this? And get on the same page with the school professionals and ensure that those are written down. Those agreements are important to write them down, keep notes, keep minutes when you go to those meetings, and make sure that you're thinking about the possible scenarios. The student might, it's not just going to be in a classroom, the student's probably going to be roaming hallways, the student might be in a cafeteria, right? The student might be receiving services and moving from place to place. So just thinking about the school day and what possible changes and adjustments might need to happen for that student, having those conversations is crucial. Parents are encouraged to prioritize this as a parent. These are unprecedented times. These are needs that are brand new. These are needs that we can't really rely on a lot of historical data to say, oh, this is what we should do. So you have to trust your gut as a family member, as a parent, and say, for my child, we're gonna go this route and go for it. You should express your concerns. We encourage families to think outside of the box. We try to brainstorm with them as best as we can. We encourage professionals to brainstorm with families. And again, to individualize that plan, because these plans are meant to be individualized. That is the one piece that is going to excel. Individualize it to the student so that they can learn, so that they can be included, so that they can experience growth. Engage other health experts. And of course, communicate. Unfortunately, a lot of communication kind of went by the wayside when the soft school closures happened, and parents still have a bit of a sour taste because of it. But now things we have learned from the last few months, not just families, but professionals, as you can imagine. And great efforts are being made on their end to try to include families, to try to support students. So keep that communication going. And these are some things that we share with families when their child may need more hands-on supports. Small group or one-on-one services may be available in the school. Schools have been disinfecting and providing areas of the school for such services, so those are efforts being done. A combination of online and in-person can be used if that's what's needed for the student. In other words, IEP teams can deviate from you're either coming to school or you're doing it all remotely. Well, what if the student needs a blended model? Have those conversations. It's possible if the team agrees that that's needed for the student. Parents, when they desire, can team with schools and get training from the school as a related service on the IEP to help their child at home. If the parent has chosen to keep their child at home because of the risk, parents can still get some coaching from schools on how to best support their child if they're able to do that. Look into assistive technology that can keep your student on track and learning along with providing other supports. If the student does not make progress, oh, did I skip one? Let me see. Oh, unless, nope, done. Oh, forgive me, I lost my spot here. Okay. If your student does not make progress, compensatory services, again, those can be reviewed as a team together. You can ask for evaluations. If the student's just not making any progress, that doesn't mean you forget about them. It means they might need more in the future to help with the gaps that were created. Adjust goals to reflect what can be worked at home. If, again, a parent chooses to do that, that cannot be forced on a family. If they are able to and desirous to support students in the home, that can be arranged through the IEP process as well. The student can show learning in different ways. We remind families and also teams that students can show what they've learned in a variety of ways, and that even in a virtual setting, rewards and praise can be given. Social interaction proves to be quite important, and in a remote setting, if a student's not having that in person, then thinking about when those could happen. I know many classrooms were dedicating specific times on a Friday, for example, where students could just meet and have a social half hour, for example, where they could interact with friends. So those are things to be asked about if that is not already in place for your child. Make a schedule, try to stick with it, include breaks and rewards. Just think about how you can make that learning opportunity, if they're at home, as engaging as it can possibly be. And finally, this is the guidance from the Department of Education. Continue the efforts, continue to instruct, continue to support, and have high expectations for students with disabilities. In other words, nobody has waived those rights. Special education and related services can be provided through distance instruction, although they recognize it's not always possible. And in those cases, that's when we have to think about how to support those students going forward. And a free and appropriate public education is still expected for students. Be creative in your solutions, and more than anything, be patient, because I think both professionals and families together are trying to navigate this as best as they can. So I will open it up to questions at this time.
So I do have a question.
Yes.
This is Heather. I'm with Draper, Wasatch Pediatrics. I would like to know maybe what your recommendations are for parents who are calling in and asking for letters to excuse their child from wearing masks. So our providers decided here at our office that they are not going to write support letters to omit masks. I was getting a little bit more calls before school started because I think parents were panicking. And
sure.
Yeah, so it has slowed down, but when I've got an upset parent because doctor won't write a letter, I'm not sure where to refer them to. I did refer one mom to the school to ask, what their policies are and maybe if there's any accommodations that they can get that way. I don't know if that's something, if they have an IEP or a 504, is that something that I encourage them to discuss with the school? And I just don't know where to have them go other than tell them, sorry, we cannot write a letter for you, or we're not writing letters.
Yeah, I mean, the two things that can come up, right, is they're asking for one of two reasons. One, they've been asked to provide some medical documentation, some letter backing up that their child is not able to wear a mask, in which case that's probably why they're turning to you. The second one is they might be preemptively doing this, assuming they're going to be asked. So it would be important to note the difference when families call and say, are you being requested to get this information? And if the answer to that is no, it certainly makes sense to say, you know what, it's important to have a conversation with your school. They know your child. They also know what his or her special needs are. Have a conversation and see if an accommodation could be provided without this, because they haven't asked for it. Now, if they are asking the families, they are definitely expecting to get something from a healthcare professional. And it may not necessarily be that you have the knowledge of the student, but the family assumes that you do. So if that's not the case, then thinking through who among your provider team that you've been working with could give you that information. So just, I guess, a little bit of understanding that schools might be asking them to do this, and that might be why they're calling. And the fact that it's subsided now, it's because many of them have made their choice for this quarter, but that choice is going to be in every quarter. So that wave might come right back.
Okay. Thank you.
I guess, can I add something to that? Or a question? So I'm at Busy Bee Pediatrics, and our providers have decided the exact same thing as well. They will not write and sign for them, regardless if it's been asked or not. So that is why I guess my question is to add on to the other question is there another place to be able to send these patients to get the help that they need when we've deemed that we don't want to be, I guess they're more thinking that it's kind of a liability that we've now signed, and now if they bring COVID and all of this stuff, so they are refusing regardless.
Exactly.
So is there, I guess, another avenue?
Wow. I mean, honestly, my first thought is then where do families turn, right? If they're being asked for one thing from the school side, yet from the healthcare provider side, they're being told we don't do this for anybody, it's not just you, then who do they turn to? So yeah, at the end of the day, again, it does matter whether they're being required or not. If they are, I think brainstorming as to where they should be receiving that, and maybe it's somebody that knows the behavior of the student, maybe it's got to be somebody that has done behavioral services, but if they've never had that contact or experience, it really I think creates an additional barrier to families to have a blanket, we don't do this for anyone, for sure.
I just want to, on the COVID-19 page, this is Linnea, on the COVID-19 page, which I know Mindy has mentioned several times, we do have the guidance that's been compiled for University of Utah pediatricians, which is not, and I did put the link in the chat, but it's not quite as blanket as some of you are saying that your practices are doing, but it's fairly, we don't do that. It's in the return to school in Utah, Mindy. Scroll down. It's wearing masks. Oh, now you went too far. Up. There it is. Wearing masks at school. So, yeah, it's fairly, yeah, we aren't going to do this in most cases. But I mean, it is just another resource, I guess, or another set of information.
And this is Mindy. I think what I'm hearing from Nikki and Heather, and of course, to really drill down and understand the nature of each one of the requests is going to take time, which is the problem, right? But I think what I'm hearing is that there are parents who, at first glance, their children don't have a reason under Section 504 or IDEA to not wear the mask. Is that, would that be accurate, Heather and Nikki?
I've had both.
Me as well.
I've had from my son has ADHD and can't wear a mask, to asthma, to we did have one provider write for a couple of medically complex children, but that was before our providers decided, no, we're not going to. One of my providers has very medically complex children, and mom was very adamant about the child not wearing a mask. Our provider said, every child is capable of wearing a mask, but you have to work with them on it, and you've got to practice with them. But it is for the safety of the other children at school, and for the safety of the teacher and the staff as well, and your students. So that is why they just came up with I'm sorry, but I've had different ones. So that's where I thought if I do have ones that actually have an IEP already at school or have a 504, to work with the school to see if they can implement it. But then if the school comes back and wants a letter from us, that's where we're running into problems, because our providers are saying, we're not going to write a letter for you. So
if,
yeah, and
I guess I would, as a parent, right, if the school were asking me for something that perhaps my provider was saying as a blanket response, we don't, my question to them would be, is there a protocol or a way to assess whether somebody needs an exemption on your end? Because that might be the way to think about it. Is there a way to assess so that somebody can feel comfortable saying, well, based on what we observed or what we saw or what we know, this student really doesn't or isn't capable of wearing a mask? Because I understand these are just conversations, the family's telling you they can't for whatever reason.
Yeah, and with our practice, I mean, unfortunately, it doesn't matter. We are not writing them for anyone. Like, we've even had, I've had autism going to spectrum that needed one. And we're saying no. And we're kind of saying the same thing. You need to work with them, do it 5 minutes a day, keep adding it. But we're kind of seeing the same thing on all. Same with what you guys were talking about, from asthma, ADHD, autism. And I guess that's where we're just hoping that there's another avenue for these families that they can turn to.
If a student is known in the school setting and those behaviors are sort of documented in their file, their evaluation, their abilities, families are able to have conversations with their teams. The problem they'd run into, based on the guidance I've seen from the State Board of Education, is if this is now sort of new and hasn't been documented anywhere before, that you could directly relate it to the wearing of masks, where they're kind of on their own to go find supporting information from a healthcare provider.
Boy, this is really tricky, isn't it?
Yep.
Yeah. This has definitely been a hard one for our practice as well.
And it has for us. We've had upset parents, and it makes for a very difficult situation. But I think that you're right, though, that it has slowed down a little bit since school has actually started. And I think people have decided whether they're going back to school or they're going to keep their children at home. So I think that, but this is some of the districts are term by term. So I anticipate that when the next term starts and they decide they want to go back, there might be an influx of calls again.
I think you can count on it. I'm definitely going to take this information back, right, to the State Board of Education, because I don't know that they knowingly understand what's happening on your end. I know I didn't know this was happening on your end till hearing it right now. So this is definitely something that might feel like just two closed doors for a family and really no window to open. So there's got to be something that could be done.
And I just had one more request, because I was writing stuff down as I was listening. Would it be possible for us to get an updated list of your district parent advocates? I don't know if any of them have left or still there, but that would be helpful if we could maybe get an updated list.
Oh, absolutely. Actually, we recently created a list by project and who works under those projects, and that includes our district consultants. I'm happy to share that with Mindy so she can share with the group.
Perfect. Thank you.
I could tell you though at this point, just off of memory, I can tell you where we have a particular parent consultant. So two things. We do have parent consultants that serve the entire state, regardless of where the district is. But then we do have some contracted individuals. We recently just added Box Elder School District, which is exciting, but we're in the hiring process for that person. So not somebody you could contact today, for example, but soon. We do have somebody in Granite School District, Salt Lake School District, Canyon School District, Nebo School District, Davis School District. Let me think, I know I'm missing one or two. Oh, Tooele School District is the other. And let me see. Just going down the geography in my mind.
Alpine.
Thank you, Gina. Alpine School District.
If you can add the state ones to that list, just because they'd be a good backup in case.
Yeah, so just by calling our main number, parents would be connected to a parent consultant that could support them statewide.
Okay. So I have a question. Also, I have a patient that was going to school with a nurse, I believe in the Canyon School District. And now her mom is worried about COVID, going to teach her at home, but mom speaks Spanish only, is very low tech, hasn't been able to get on the Zoom calls with the school when I've tried to Zoom on their IEP type things. She wants a nurse that can come and be at home with her to do school. Is that an accommodation that's within the guidelines of an IEP?
So it definitely depends, not knowing the particulars of the student, the details about the need and the supports needed. Almost anything under an IEP. To put it frankly, almost anything is possible under an IEP. It just depends on the documented need and whether it's reasonable. So at this point, if there are certain offerings that are happening in the school setting, but the parent is choosing not to send the student, an LEA could determine that the offer was made, but a choice was also made on the parent's end to not utilize it. Yeah. Does that make sense? So the details will definitely matter.
Okay. Thank you.
Can I ask one more question? Do we have time?
It's up to Esperanza. We're at 10 o'clock, so people could drop off if they needed to. Esperanza, do you have just another moment?
Absolutely. Go ahead and ask.
Thank you. So my question is, so if the child is on an IEP, but yet the parent doesn't feel like it's meeting his needs or the patient's needs, what is the best avenue for us to give them resources on how to help change it or increase, needs? Like, so for instance, I have a patient that they were talking about, they're just getting read these words, but that's not even what is on the IEP. They're saying they're focusing on, K's and L's, but yet it's read said, so it's not even focused on them.
Yeah, no, I understand. And truly a couple of answers to that. The first one is having a meeting or a conversation with their IEP teams about what's not working is going to be necessary. So whether they are reaching out by email or trying to set up a meeting and have a conversation about their doubts and concerns, and hopefully getting them organized so that they can sort of get to the point and be concise about the issues, and also brainstorm some changes they would like to see and propose them to the team. That's absolutely legitimate. And they can always call the Utah Parent Center and somebody can discuss the issues with them, help them organize their thoughts, and sort of help guide them in the process. We do have a parent handbook on the IEP process, and the process really is get together, chat with the team. Is there information or data to back up what you're saying or asking for? And if so, let's get it out there so everybody's on the same page and make adjustments for the student to benefit.
Okay, perfect. Thank you.
Mm-hmm.
Okay, it's just after 10 and I think we're about ready to wrap up. I do have one quick question for Esperanza. Are you seeing any additional issues in getting IEP meetings pulled together with COVID?
Yes, I think as professionals in the school setting are stretched thin, some of them are being asked to teach in person and online for the same classroom and just be extremely flexible in what they're doing in the schools. I think their time is definitely incredibly tied up. And so we've seen some delays in students becoming identified for IEPs or actually getting a team together for those IEP meetings. I do believe schools are prioritizing those situations that might seem alarming to them and they're trying to act and accommodate, but I think parents are going to do well to communicate actively and continuously, so not necessarily just give up if they're not hearing back right away, because I do think the time constraints on those professionals is definitely stretched to the max.
Gotcha. Okay. Well, it is very strange times, and wish that we had great answers for every question and every situation, but that's just not the case right now. I think it's not possible. Thank you so much, Esperanza. We really appreciate your time, and we will get your contact information provided to the group. And we'll also send out that list of, district advocates and so forth when we get that from you. And yeah, thank you. This has been really helpful.
Good, I'm glad. Thank you so much for hosting the training. I appreciate that as well.
Definitely. All right. Well, thanks to those of you who are still on the call. Next month, we'll be following up on the transition topic, which will be timely because we'll have just had that transition summit. And again, watch for some emails from me with regard to doing the transition survey and getting registered for that meeting. Remember that you're always welcome to use this listserv email address if you have any need for help and brainstorming and resources between our meetings. And we hope that you're staying safe and healthy, and good luck with everything. We'll see you in a month.
Thank you.
Mindy.